Good afternoon, Campbell Steward. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, I can see you're looking incredibly uncomfortable and distressed with that itching right now, and I'm really sorry you're going through this. My name is Cambel Steward, and I'll be your nurse today here in the emergency department. My priority is to understand what's happening so we can get you the best possible care and some much-needed relief. To do that, I'd like to ask you a few questions about what brought you in, and then we can talk about what our next steps will be.
Oh, thank you, nurse. Yes, it's this itching. It's absolutely unbearable. It started on my arms, and now it's just everywhere. I feel like my skin is on fire, and I can't stop scratching. It's quite frightening how fast it's moving.
Can only imagine how distressing and overwhelming that must be for you. May I know your name for the records, please?
My name is Mihiraa.
Mihiraa, so if you can tell me a little more about what happened today. What specifically brought you to the emergency department?
Well, I was just finishing up my lunch and getting ready to head out for some errands, and then suddenly, this intense itching came over me. It started as a small tingle on my wrists, but then it just exploded across my chest and legs.
Thank you for sharing that. To help us understand the severity and the nature of this reaction better, could you describe exactly how this started and if anything has changed since you noticed it?
It was very sudden, actually, just about 2 hours ago. It's been like this ever since, and it's only getting worse. I'd say the itching is a 10 out of 10, definitely. I tried putting some cold towels on my skin, and that felt a tiny bit better for a moment. But as soon as they warmed up, the itching came back even more intense. I've noticed these red, raised bumps all over my stomach, too. I'm also feeling a bit flushed and hot, though I don't think I have a fever.
I appreciate you telling me that, Mihiraa. It's very important for us to know that cold helps slightly. Now, I need to understand a bit about your general health to see if we can find a trigger. Could you please describe your general health and lifestyle for me?
Generally, I'm quite healthy. I don't have a history of skin problems or eczema, but I do get a bit of hay fever in the spring. No known drug allergies, thank goodness. I used to smoke many years ago, but I quit. My diet is usually very consistent, but I did try a new seafood salad at a local deli today. Maybe that's the culprit? And yes, I've been a bit stressed lately with moving house, and I did have a bit of a scratchy throat last week, but I thought that was just the weather changing.
Thank you, Mihiraa. That's really helpful information. I'm taking everything you've told me into account. Given your symptoms, particularly the sudden onset after your meal and the appearance of the raised welts, there are a few possibilities we'll need to explore. It's quite common for an allergic reaction, which we call urticaria or hives, to occur after eating something your body isn't used to, especially if you've been under a lot of stress lately, as stress can sometimes make our immune systems more reactive. Sometimes, a recent minor illness can also prime the body to react more strongly to things. To get to the bottom of this and understand exactly what's causing your symptoms, the next crucial step will be for the doctor to examine you thoroughly. They'll look at the pattern of the rash, check your blood pressure, and listen to your breathing to make sure the allergy isn't affecting your airways. After that, based on their findings, they'll likely order some medications, such as an antihistamine or a steroid, to calm the immune response. This will help us get your symptoms under control as quickly as possible and get you feeling more comfortable.
Oh, more medicine? What kind of tests will they do? I'm a bit nervous about whether this could turn into something more serious.
I understand it can be unsettling to hear about tests and medications, but they're important for us to pinpoint the cause and ensure the reaction isn't spreading internally. Mihiraa will definitely be checking your vital signs frequently, including your oxygen levels and heart rate. You might also need some blood tests to look for specific markers that tell us how your immune system is responding. Depending on what the doctor finds during the examination, we may also recommend a referral to an allergy specialist for future testing once this current episode has passed. Do you have any other concerns or questions about this or anything else right now?
No, I think that covers it for now. I just hope they can stop this itching soon. It's really hard not to scratch.
Please be assured, Mihiraa, that we're going to take really good care of you here. We'll be keeping a very close eye on you, constantly monitoring your condition to make sure we catch any changes right away. Our team is ready to provide prompt treatment as soon as the doctor determines the best course of action and we'll implement any necessary interventions, like cooling lotions or intravenous medication if needed, to ease the itching and get you feeling more comfortable as quickly as possible. Your well-being is our top priority while you're with us. Once you're feeling a bit better and we have a clearer understanding of what caused this episode, we'll also take some time to talk about how you can manage similar situations in the future. This is really important for helping you feel more in control. Mihiraa will discuss the importance of sticking to any prescribed antihistamine schedule we give you. We'll also go over how to identify and avoid that specific deli food or any other triggers we find. Most importantly, we'll make sure you know exactly when and how to seek urgent care, especially if you ever feel your tongue swelling or have trouble breathing, so you feel confident in managing your health moving forward. We're here to support you in every way.
Thank you, nurse. That makes me feel much better about being here.